Dr. Cat, epidemiologist. This person's asking about the vaccine and pregnancy, and since we have some new information, rather than tag her in my other videos, I thought I'd make a new one so we can all be up to date. Starting with infertility, we have absolutely no data to associate the vaccines with infertility at all. We don't even have a biologically plausible mechanism as to how that might happen. And in fact, we have seen thousands of women get pregnant after vaccination in the clinical trials and in the CDC's V-Safe program. We do know, however, that COVID-19 illness can be associated with infertility in males. That we do have data to support. So it's even more important for males that want to have children to get vaccinated. Number 2, if you are already pregnant, you may want to consider vaccination because pregnant people and recently pregnant people are at increased risk to have a severe case of COVID-19. And in addition, those pregnancies are at risk for preterm birth and other adverse pregnancy outcomes from COVID-19 illness. Number 3, miscarriage. The vaccines do not cause miscarriage. That is viral misinformation that's been propagated on the internet. As you can see here, this paper was published in the New England Journal of Medicine using CDC V-Safe data. The published incidence of miscarriage is 10 to 26% just anyway in the normal population. And in this population was 12.6%, so on the low end of normal in the population. This data is brand new from Israel with the Pfizer vaccine, and while the study was meant to show efficacy in a pregnant population, which it did, the more exciting thing, I think, is this table of matched data between vaccinated and unvaccinated people showing that there's no difference in any adverse pregnancy outcomes between these two groups. As a mom myself and somebody who has tried to conceive, I totally understand that viral misinformation is terrifying about these kind of fertility issues, but just understand that we have no association between the vaccines and either infertility or miscarriage, and that the benefits far outweigh the risks of vaccination versus getting COVID if you're pregnant.